losing hair and confused about doing PRP, hair transplantation or other options, stay tuned for more information about that. Before we go ahead, do remember to subscribe and click the notification bell. We'll be talking about hair restoration. I'm Dr. Hussain. So before we go ahead, we need to talk about what a graft is and what a follicular unit is. Basically, a follicular unit is the naturally occurring grouping of hair. So hair can grow in groups of 1, 2, 3, 4, 5, 6, 7, even 8 and 9, but most of them are between 1 to 4 hairs in one follicular unit. That is the way they grow together in units. Most of the hair will grow in 1 to 4 hair units. It can be more than that. If you have a graft, in medical terms, it's any unit that the tissue that is being transplanted is a graft. So in a kidney transplant, the kidney would be a graft. If you do a partial liver transplant, the tissue that you're transplanting will become a graft. If you have a 2-hair graft here, you have a total 15 hairs here. There's the 5th hair here, it may not be visible, but you have 15 hairs here. If you have a 2-hair graft and divide it into 2 single hairs, you would have 2 grafts. So medically speaking, it would be correct to say you have 2 grafts. But you don't get more pizza because you divide it into double as many slices. So just cutting that into 2 would give you 2 grafts, but the results will not be any better, maybe even worse, because the survival of the graft could go down if you cut it. Anyway, that's important to understand. So you have 2 options in terms of hair restoration: a hair transplant, the surgical option, which gives nearly always permanent results. In few cases it won't, but it's nearly always permanent. Medical hair restoration, what's important to remember is that it requires maintenance. It requires maintenance. It's important to understand to get the full cost of it and the full trouble that is involved with the medical hair restoration. If you have to go to the clinic 1, 2, 3, 4 times a year, then it will add to the cost and how much of a bother it is to have your hair restored. I'm not saying it's not a good idea, it's just that you have to take it into account. With hair transplantation, you have basically 2 options: a follicular unit extraction, where we take each follicular unit one by one. There's no stitching in this, and there's no pull on the tissue in the same way as a strip surgery. In a strip surgery, we take a strip of hair from the back of the head or the sides, and it leaves a gap that is then stitched, and there's a pull on the tissue which can leave a linear scar. With FUE, you don't have any linear scar. The problem with FUE is it's very time consuming. If you need to take hair, for instance, from the head, from the beard, from the chest, from the back of the body, then it can be quite time consuming. That's a major backdrop, although with motorized extraction it's getting faster. As I just said, you can use all the body hair as a donor. Essentially, mostly what we use is head, beard and chest and back of the back, and pubic hair. There's no linear scarring in follicular unit extraction, and there's less pain because we don't have to stitch anything. We don't have the traction and the pull on the scars the same way. With strip surgery, you have this linear scar, which is a major backdrop because you cut out the tissue, put the edges together, pull them together, and that can create pain, and it can also lead to scarring. The good thing about strip surgery is the harvesting is very fast, often half an hour to 45 minutes, and the strip is handed over to the technicians to divide it into smaller units. It can be FUT and non-FUT. If you remember, if we had the follicular units that I just showed you, the grafts, you can divide a 2-hair graft into 2 single hairs, and medically speaking you would have 2 grafts. But it would not be a follicular unit any longer because you cut that follicular unit into halves. Likewise, if you take a 4-hair graft, cut it into 4 pieces, it's no longer a FUT surgery. You can also have, say, 3 2-hair grafts, 3 2-hair follicles coming together in one graft because you cut the strip like that, and then it's still not FUT. The other issue with the strip surgery is the donor area is more limited. You can only use the back of the head and the sides for all practical purposes. Because you have this cut and you pull the edges together, it also gives more pain. This is an example of FUE after 14 months, I think, and this is a 4-year-old scar and 6-month-old scar from the UK. This is a patient from Norway. 15 months after the surgery, he came back for more, and this is how the joint area looks. This is a strip scar. There's clearly a difference between these two. This is 12 days after FUE, and this is years after strip scar and few days after FUE from this area. 7-8 days after FUE extraction, and this is years after strip surgeries in Norway, UK and Germany. This is FUE donor area down here, and a strip scar that is very old. Here we have a strip scar, but this is actually FUE donor area that is 10 days old. Quite remarkable. You can't see nothing here, but here you see the strip scar that is years old, FUE donor area. So let's talk about medical hair restoration. Again, I know I've said it, I will say it again, it requires maintenance. It's faster, it can be down to, in office could be from 30 minutes to 1.5 hours, and it's low cost per treatment, but the total treatment over a number of years would be higher. When you have medical hair restoration, you have to, likewise also with hair transplantation, you have to look into if there's any underlying medical condition that is causing the hair loss, and of course that it needs to be treated. If you're hypothyroid or hyperthyroid, if you have hormonal issues, if you're anemic, if you have medicines that are causing the hair loss, we need to look into that and try to use some substitutes, alternatives where you won't have the hair loss. If you have a healthy body, you're more likely to be growing better hair than if you are having a very poor body. So general good health is important. Medicines, the options are like minoxidil and ketoconazole, for instance. Minoxidil can be used by men and women. Ketoconazole is in cases of fungal infection, can be used by men and women. Finasteride and dutasteride are for men. The reason they're in red is because I really don't like them. They're side effects like decreased sex drive, impotence, nipple pain, testicular pain. And some patients have complained that there were more long-lasting side effects even after stopping the medicine. Finally, in the recent couple of years, there have been more reports on psychological issues from patients having finasteride and dutasteride. Steroids can be used, for instance, in case of alopecia areata. Medical hair restoration can also be in forms of microneedling, PRP, stem cell therapy, and often we combine these. It can be used in cases of androgenic alopecia, a male pattern baldness that affects around 50 million Americans and American men, and around 30 million patients with female pattern baldness in America. Alopecia areata is an autoimmune disease where the immune system fights its own tissue. We can use steroids for that. You can also use medical hair restoration to get longer hair faster. We have quite a few patients of that kind. White hair, we have some few cases where we've seen white hair turning, getting their color back from having, for instance, PRP, but we don't see it consistently. It can speed up spontaneous recovery. Say if you have a medical condition and you're recovering from that and you want to give it an extra push, we can help with the medical hair restoration. And it can also speed up the results from hair transplantation, for instance, PRP. It can give you faster healing, and it can also give you faster results. So that's all about hair restoration. It's just an introduction. There's much more to talk about. Thank you for now. I'm Dr. Hussain. Do remember to subscribe and click the notification bell. Thank you.